What is health insurance? Types of health insurance. There are two basic types of health insurance. 1. Mediclaim plans. Mediclaim or hospitalization plans are the most basic type of health insurance plans. They cover the cost of treatment when you are admitted to the hospital. The payout is made on actual expenses incurred in the hospital by submitting original bills. Most of these plans cover the entire family up to a certain limit. 2. Critical illness insurance plans. Critical illness insurance plans cover specific life-threatening diseases. These diseases could require prolonged treatment or even change in lifestyle. Unlike hospitalization plans, the payout is made on critical illness cover chosen by the customer, not on actual expenses incurred in the hospital. The cover gives the flexibility to use the monies for changing lifestyle and medicines. Also, it's a substitute for income for the time you could not resume work due to illness. Why do you need health insurance now? No one plans to fall ill or get hurt, but a serious illness can strike anyone at any time. The cost of treating the illness can cause severe financial strain on the savings you have accumulated over time. This means that you might have to compromise on providing your child the best quality education or defaulting on your home loan payments. Today, the cost of medical treatment is continuously rising. For Herceptin, a cancer medicine costs approximately $110,000 for a vial of 440 mg. Depending on the weight, a patient usually requires 17-19 bottles for treatment over a year. That's 18-20 lakh just for the medicine tilde. Then add hospitalization costs, doctor consultation fees, chemotherapy costs, etc. And your overall expenses could exceed 25 lakhs. These costs, which are already very high, are increasing every year. Most smart people have taken necessary precautions to ensure their health as soon as possible. Health insurance is a living. How to choose a good health insurance plan. Anybody who has a health insurance policy will tell you that buying one is one of the smartest financial decisions by any earning individual. Now that you have decided to buy a health insurance policy, you need to know how to select a good health insurance plan that will take care of all your needs. Here is a list of benefits any good health insurance plan should offer you. Protection against a large number of critical illnesses. Flexibility to choose your health cover. No increase in premiums during the policy term even if your health condition changes. Long policy term that covers you even in your old age. Large hospital network for easy access to medical treatment. Should I buy a Mediclaim plan or a critical illness insurance plan? A Mediclaim plan will either reimburse all your hospitalization expenses or settle the hospital bills via a cashless facility. With a critical illness insurance plan, you will receive a lump sum payout on the detection of a critical illness. You don't have to be hospitalized for the same. If you are unable to work because of the illness, then you can use the amount as a substitute for your monthly income. You can even use the money to cover expenses for doctor visits, medicine purchases, medical tests, or any other expense that might arise during this time. That is why you need both a Mediclaim plan to cover your hospitalization expenses and a critical illness insurance plan to cover your loss of income and other expenses that arise due to an illness. Health insurance system for the financing of medical expenses by means of contributions or taxes paid into a common fund to pay for all or part of health services. Health insurance may apply to a limited or comprehensive range of medical services and may provide for full or partial payment of the costs of specific services. Benefits may consist of the right to certain medical services or reimbursement to the insured for specified medical costs. Some types of health insurance may also include income benefits for working time lost because of sickness, i.e., disability leave or parental leave. A health insurance system that is organized and administered by an insurance company or other private agency with the provisions specified in a contract is known as private or voluntary health insurance. Private health insurance is usually financed on a group basis, but most plans also provide for individual policies. Private group plans are usually financed by groups of employees whose payments may be subsidized by their employer with the money going into a special fund. Insurance of hospital costs is the most prevalent. Any system that is financed by legally mandated compulsory contributions or by taxes and whose provisions are specified by legal statute is known as a government insurance or social insurance. This type of medical insurance plan dates from 1883, when the government of Germany initiated a plan based on contributions by employers and employees in particular industries. In the United States, Medicare and Medicaid medical insurance for the elderly and the poor, respectively, are government insurance programs. The distinction between public and private programs is not always clear, because some governments subsidize private insurance programs. Quite different, however, are government medical care programs, which are sometimes characterized as socialized medicine in the United States. In these systems, which are usually financed from general tax revenues, doctors are employed directly or indirectly by a government agency, and hospitals and other health facilities are owned or operated. In the United States, health maintenance organizations, HMO, became popular in the late 20th century as a way to control medical costs through the use of prenegotiated fees for medical services and prescription medicines. An alternative to the HMO is the Preferred Provider Organization, PPO, also known as a participating provider option, which offers features of traditional fee-for-service insurance plans, such as the ability of patients to choose their own healthcare providers, but also follows the lower-cost strategies of HMO. For example, those enrolled in a PPO can see any medical provider at any time, without a referral from a primary care physician. However, if the insured uses one of the insurance company's preferred providers, the company generally pays a higher percentage of the cost. In both HMO and PPO, the insured is usually responsible for a certain portion of the cost of the medical services, with a co-payment fee paid by the insured. 5 benefits of health insurance. It is rightly said that health is wealth. Changing lifestyle habits, increase in pollution levels, and many other factors have a severe impact on an individual's health. This may cause various health conditions and medical diseases. Medical costs associated with the treatment of such diseases are increasing rapidly. In order to safeguard your finances against high medical bills, it is necessary to invest in health insurance plans. Such plans cover all hospitalization expenses as well as pre-hospitalization and post-hospitalization charges. 1. Coverage against medical expenses. The main purpose of medical insurance is to receive the best medical care without any strain on your finances. Health insurance plans offer protection against high medical costs. It covers hospitalization expenses, daycare procedures, domiciliary expenses, and ambulance charges, besides many others. You may, therefore, focus on your speedy recovery instead of worrying about such. 2. Coverage against critical illnesses. Insurance providers nowadays offer critical illness insurance either as a standalone plan or as a rider. Such an insurance policy provides coverage against life-threatening diseases such as kidney failure, bone marrow transplant, stroke, and loss of limbs, among others. Upon diagnosis of any of the critical illness from the predetermined list of your policy, you are entitled to receive a lump sum amount. This amount may be used to meet your illness-related treatment costs, daily expenses, and any other financial obligations. 3. Cashless claim benefit. Many insurance providers offer cashless claim facility. In such an arrangement, you do not have to make any out-of-pocket payments. The hospitalization expenses are settled between your insurer and the hospital. To avail of this benefit, it is imperative to get admitted at any of the insurer's network hospitals. You may fill out a pre-authorization form and display your health insurance card. 4. Additional protection over and above your employer cover. Many organizations cover their employees with a group insurance plan. However, such policies are not tailor-made according to the needs of every individual. Besides, you may be left uninsured in case of loss of job or change in employment. In order to protect yourself against such an event, purchase a health cover individually. 5. Tax benefits. Healthcare plans provide tax benefits. Premiums paid towards your healthcare policy are eligible for tax deductions under Section 80D of the Income Tax Act 1961. The quantum of deduction is as under. In case of the individual, Rs. 25,000 for himself and his family. If individual or spouse is 60 years old or more, the deduction available is Rs 50,000. An additional deduction for insurance of parents, father or mother or both, whether dependent or not, is available to the extent of Rs 25,000 if less than 60 years old and Rs 50,000 if parents are 60 years old or more. A deduction of Rs 5,000 will be allowed under this section for payment of preventive health checkup of either the individual himself or his family members, which include spouse, parents and dependent children. This deduction is not in addition to the deduction of Rs 25,000/50,000 stated above, but is included in the above deduction. Keep these advantages in mind and choose from numerous medical insurance plans available in the market. Based on your personal needs and requirements, select the best plan and do not miss out on the opportunity to enjoy all these benefits. Cheap car insurance. Car insurance costs are at near 7-year lows, but only for those who regularly switch to get the best prices. Yet from January 2022, a rules revolution will see insurers banned from charging renewing customers more than newbies, likely meaning higher prices for those who regularly switch, so check now if you can save, even if not at renewal. Our tried and tested system will help you bag a cheap car. Many can save peace-zone hundreds by switching car insurance policy. Here's a quick lowdown if you know what you're doing and just want to find a cheap policy. Alternatively, if you need a bit more help, you can read our full guide below. 1. Never just auto-renew, instead get quotes from comparison websites. Comparison sites don't search of identical insurers, nor give identical prices, so try as many as you've time for in this order: confused.com *, compare the market *, money supermarket *, and GoCompare *. 2. Get quotes from direct insurers and find exclusive MSC deals. Direct line * doesn't appear on comparison sites and can be competitive. You also won't find some special deals, see hot deals comparisons miss. 3. Then check to see if cashback sites can beat the quotes you got above. Top Cashback * gives PS42 when you buy through its comparison, and Quidco * PS40. But it's also worth checking if you can then up that amount by going direct to the insurer through Top Cashback * and Quidco's *.